You're live.
Hi everyone, it's Danielle and Elizabeth with Dr. Emer's office. We are doing a special feature today. So we are doing one of our very classic, favorite treatments, a combination of Clear and Brilliant and the Cosmetic Peel. Elizabeth is one of our estheticians and she knows the Cosmetic Peel so well, and what we wanted to do is open it up to a lot of our audience who is Spanish speaking. And so we are going to be talking about today's treatment, talking about the skin and this condition and how to make it better in both English and Spanish. So basically, as a provider, when it comes to melasma, you want to pick treatments that are going to improve the pigment and not risk putting enough energy into the skin or heat into the skin that it can worsen it. So the Clear and Brilliant Permea has become a fan favorite. We love it, and it's really the gold standard for melasma because it is going to gradually lift up that pigment but also improve the overall texture of the skin. So melasma is contributed to by hormones and by heat, and there's not a lot out there that's going to make it better. This has become a favorite. So if you want to explain some of that in Spanish.
Yes. Hola a todos que nos están escuchando que hablan español. Estamos aquí. Danielle está haciendo un tratamiento que se llama Clear and Brilliant Permea. Y este tratamiento lo vamos a combinar con nuestro peeling que se llama Cosmelan. Ayuda con las manchas. No sé si pueden ver, nuestra paciente aquí tiene manchas en los dos lados de los cachetes. Y ahorita vamos a empezar el tratamiento con el Clear and Brilliant Permea porque nos va a ayudar a que el Cosmelan vaya a penetrar más profundo y vaya a penetrar las manchas específicamente y tratar las manchas. Nos gusta combinar este tratamiento con Cosmelan porque nos da mejores resultados tratando manchas que ya llevan muchos años. Nuestra paciente aquí, Cecilia, ya lleva casi 10 años con sus manchas y este tratamiento le va a dar unos resultados muy, muy buenos.
So the other thing, like she was saying, she's had this pigment for 10 years now. So yeah. Cosmelan and Permea is going to work not just on new pigment, but also on older pigment. So this is very typical of melasma on the cheeks. It's this rigid texture on the edges, kind of varied. Sometimes it's on the forehead, sometimes it's on the lips, sometimes it's just on the top of the cheeks. For us, this is a large portion of the face, and so when we can enhance this overall appearance and minimize the pigmentation changes, she's going to instantly have a much more refreshed and youthful look all over. So by using the Permea handpiece, just like Elizabeth had said, you're increasing the permeability of the skin, and it's making it so that we're putting tiny little microchannels in the skin, and the peel is going to penetrate deeper. Those ingredients are going to be even stronger and more effective and give her a great result. So you'll get a good result with Cosmelan, but by combining it with laser, you're hitting it from more angles than just one. And with pigment, which can be really stubborn and have so many contributing factors, you want to know that you are giving it your best, kind of attacking from all angles and really maximizing the efforts. And that's what this treatment does.
Lo que a mí me gusta mucho de este tratamiento es que normalmente cuando estamos haciendo un láser o un tratamiento que produce calor dentro de la piel, no es muy recomendable para la piel latina, pero este tratamiento específicamente es muy muy bueno para la piel latina y no va a causar ningún problema a largo plazo. Nos gusta hacer este tratamiento antes del Cosmelan porque estamos causando que penetre el producto más profundo sin causar mucho calor dentro de la piel. Cecilia, nuestra paciente de hoy, ha sufrido con estas manchas por 10 años. Como estaba explicando Danielle, melasma se ve porque normalmente si está en un lado de la cara va a estar en otro lado de la cara. Entonces si lo ves en un cachete, lo vas a ver en otro. Si lo ves en la frente, lo vas a ver también en los labios, sí, alrededor de los labios. Ahorita, Cecilia, ¿qué siente?
No, esto es un pequeño hormigueo en la piel, pero no se siente dolor.
¿Le duele?
No.
Okay. Sí, es un tratamiento muy tolerable, no duele. Y lo que nos encanta es que no va a causar más problemas de manchas, como muchos de estos láseres sí causan. Y Cecilia vino a visitarnos a nosotros hoy porque nosotros sabemos exactamente qué láser podemos hacer con los fototipos latinos y qué láseres no podemos hacer. Is there something else you want to add?
I was just going to add, so basically, like Elizabeth was saying, it's great for Latin skin types. Every, different ethnicities, their skin responds differently, and there's a grading system on skin color. But you also want to be conscientious of how these typical ethnicities respond to different treatments. And this is a treatment that is safe for different skin types, for dark skin types, light skin types, old pigment, new pigment. So this is a treatment that has become, very safe, very effective. And, of course, you always want to consult with your provider and discuss it with the physician or the esthetician and see what's best for you as an individual. But this is safe for all skin types. So, you may have very fair skin with dark pigment or dark skin with just moderately darker pigment, and this is still something that's going to benefit you. And also in a series, ideally, about 4 to 6 treatments to really get your best results.
Cuando estamos hablando del Clear and Brilliant Permea, se necesita hacer entre 3 a 6 tratamientos. Con el Cosmelan normalmente estás haciendo uno y ya vas a ver cambios drásticos dentro de la piel. Pero para mantener los resultados recomendamos más tratamientos del Clear and Brilliant para mantener los resultados. Do you have any questions?
No.
Is it safe to do a chemical peel? Is it safe to do a chemical peel after this treatment?
Yes, absolutely. It's very superficial, and what we're doing today is actually a peel. We're doing Cosmelan right after.
And we're doing a different type of peel than kind of what we typically think of when we think of peels. We think of inflammatory peels as opposed to irritant peels. So inflammatory peels are those typical peels that would come off in sheets. You're peeling like a snake and you're going through that downtime for a little bit. With peels like Cosmelan or Enlighten, which we use both here for pigment, you're getting a little bit of dry and flakiness, but not this dramatic peel. But the biggest difference is that an irritant peel like Cosmelan, it's not going to hurt when you apply it to the skin. It's not going to sting and it's not going to irritate. It's not going to be, high in its sensation or sting or burn. It's very mild. There's a little bit of redness and irritation just when you're washing it off. Your skin's a little bit sensitive because it's so strong in its ingredients, but it's not going to burn or hurt. So it's great to apply over a treatment like this. It works extra well because it's penetrating so well. I just want to stop right here because I'm at the halfway point. So you can see our untreated side versus our treated side. I'm just going to turn you a little bit. So you can see that there's very even color, even redness over the skin area. And her pigment's really not any darker, but we've targeted the area as a whole. So everything is going to even out. This will lighten over time, but she's going to get textural improvement. All of her pores are going to look better. Fine lines are going to look better. And not only will that happen with the laser, but it'll happen with the peel as well. So we're going to shift back this way and treat this side. Are there any other questions?
No.
Was there anything else you wanted to add?
No. Oh, yes. Sorry. Lo que acaba de decir Danielle es que con el Clear and Brilliant Permea también vamos a ver un resultado antivejecimiento, entonces nos va a ayudar con las arrugas, nos va a ayudar con la textura de la piel, también nos va a ayudar con la flacidez de la piel, y el Cosmelan obviamente va a ayudar a que se vea más uniforme la piel, que se vea más radiante, y nosotros específicamente hacemos el Cosmelan después de que hacemos Clear and Brilliant Permea. No hacemos ningún otro tipo de peeling que sea a basado de alcohol. Hay muchos diferentes peelings y nosotros realmente nos gusta combinar ese tratamiento específicamente con Cosmelan.
Does it need prophylactic treatment because of the PIH for it? Yeah.
So neither one of these require prophylactic treatment. That's a great question. When we do have patients who tend to pigment or they have darker skin types and we're using treatments that you want to exercise caution for pigmentation, then yes, we would be jumping into a prophylactic treatment regimen. Whether it is skincare at home, really aggressive pigment suppression skincare, or Cosmelan. So this is actually this really is our prophylactic regimen for our larger lasers. If we were doing an erbium, or if we were doing CO2, or if we were doing kind of like a needling treatment, which was borderline for certain skin colors, then we would be doing this treatment prophylactically. But for this combination, with Permea being very safe for all skin types and Cosmetic being very safe for all skin types, it doesn't require pre-treatment. So it's a great question.
That is a really good question. Yeah.
Keep them coming.
Any others?
Oh, yeah.
¿Yo?
Okay.
Can you
sí, estaban preguntando que si estamos haciendo un tratamiento de láser y también estamos combinándolo con un peeling, que si tenemos que tratar la piel antes con diferentes tratamientos que nos van a ayudar con las manchas para que no se produzcan más manchas después de la inflamación. Y la respuesta de Danielle es que no se necesita porque es un calor muy controlado que estamos haciendo, es un láser muy controlado y además el Cosmelan es realmente el tratamiento que usamos para preparar la piel para láseres que son más agresivos. Entonces no hay por qué empezar a tratar la piel antes de hacer este tratamiento.
¿Algo más?
¿Algo más? Yeah.
Can you guys reintroduce yourselves one more time for everyone just tuning in?
I'm Danielle Stark, Dr. Emer's PA, and this is Elizabeth, our esthetician. And this was a combination treatment of Clear and Brilliant Permea and Cosmelan. So we'll finish up our laser portion and then tune back in a few minutes for the peel application, both in English and in Spanish. All right, everyone. We'll see you soon.
Bye.